And chapter 33, common diseases and disorders. And summary reports, some points here. Cancer includes a group of diseases characterized by out of control cell division. Skin disorders involve hives, dermatitis, scabies, psoriasis, boils, cysts, impetigo, even skin cancer. Musculoskeletal system disorders affect bones, joints, and muscles, such as conditions like fractures, osteomyelitis, amputations, osteoporosis, arthritis, fibromyalgia, scleroderma, and gout. Nervous system disorders involve disruption of signals between the brain and other body parts. These disorders can affect physical and cognitive functions. Conditions described include epilepsy, stroke, acquired brain injury, Parkinson's disease, Huntington's disease, multiple sclerosis, amyotrophic lateral sclerosis, and spinal cord injuries. Endocrine system disorders involve hormones. These disorders result in hormone levels too high or too low, such as diabetes, hyperthyroidism, hypothyroidism. Cardiovascular system disorders involve the heart and blood vessels. Disorders include phlebitis, thrombus, hypertension, coronary artery disease, congestive heart failure, and arrhythmias. Respiratory system disorder involve the lungs and their airways. Disorders described here include asthma, pneumonia, bronchitis, chronic obstructive pulmonary disease. Immune system disorder occur from a malfunctioning immune system. Immune system disorders such as rheumatoid arthritis, scleroderma, inflammatory bowel disease, Crohn's disease, colitis, Hashimoto's disease, Graves' disease, and lupus. Digestive system disorder affect the proper breaking down of food for absorption by the body. Also, the elimination of solid waste. Disorders include gastroesophageal reflux disease, gallbladder disease, liver disease, celiac disease, irritable bowel syndrome, colitis, Crohn's disease, and diverticulitis disease. Urinary system disorder involve kidneys, ureters, bladders, urethra. Disorders here include UTIs, urinary tract infections, renal calculi, renal failure. Reproductive system disorders include prostate hypertrophy, organ prolapse, infertility, urinary incontinence, inability to conceive children with infertility. And that's it for the key points. Let's open up the workbook now to chapter 33, which is on page 199. 121 questions, and the first 42 questions are true or false. Question number 1. People who have osteoarthritis experience joint stiffness with activity. False. Activity is helpful. Number 1 is false. Number 2, rheumatoid arthritis affects only large joints. False. All joints. Number 2 is false. Number 3, rheumatoid arthritis affects growth. True. Number 3 is true. Number 4, arthroplasty is done to cure arthritis. False. It's just to cure the cartilage in between joints. Number 4 is false. Number 5, people can help to prevent osteoporosis by taking calcium. True. Number 5 is true. Number 6, when turning a client with osteoporosis, turn them quickly. False. Slowly. Number 6 is false. Number 7, osteoporosis causes cartilage occupying the joints to deteriorate. False. That's arthritis. Question number 7 is false. Number 8, infant who has a fracture may be a victim of child abuse. True. Number 8 is true. Number 9, phantom limb pain occur when a client has an amputation. True. Number 9 is true. Number 10, a stroke occurs when brain cells get too much oxygen and too many nutrients. False. Too little. Number 10 is false. Number 11, all clients with Parkinson's disease have impaired mental function. False. Number 11 is false. Number 12, multiple sclerosis is short-term disease. False. Number 12 is false. Number 13, A client with COPD is at risk for respiratory infection. True. Number 13 is true. Number 14, the use of condoms reduces tuberculosis. False. Number 14 is false. Flip over the page. Number 15, clients with tuberculosis have overproduction of thyroxine hormone. False. Number 15 is false. 16, angina pectoris occurs when blood vessels narrow, heart pumps with more force. False. The opposite. Number 16 is false. 17, activity will relieve angina pain. False. That's what causes it. 17 is false. 18, common term for myocardial infarction is heart attack. True. Number 18 is true. Number 19, the goal of cardiac rehabilitation is not to have another heart attack. True. Number 19 is true. Number 20, when a client has renal calculi, you should strain the urine. True. Number 20 is true. 21, when a client has persistent renal failure, only the renal system is affected. False. All systems. Number 21 is false. Number 22, you need to follow standard practices when disposing of vomitus. True. Number 22 is true. Number 23, a client with HIV but has not developed AIDS yet cannot infect others. False. They can. 23 is false. 24, elevated toilet seat is helpful for clients with limited range of motion. True. Number 24 is true. 25, juvenile rheumatoid arthritis occurs in children. True. Number 25 is true. Number 26, preventing deformities is one of the goals in treating rheumatoid arthritis. True. Number 26 is true. Number 27, when a client has osteoporosis, a fracture can occur because the bones are very brittle. True. Number 27 is true. Number 28, shingles are caused by allergic reactions. False. Number 28 is false. 29, a client with emphysema can breathe more easily if they're in upright position. True. 29 is true. 30, exercise and physiotherapy can help Parkinson's disease improve posture and balance. True. Number 30 is true. 31, repeated asthma attacks can damage respiratory system. True. 31 is true. 32, scabies appear as white circular patches. False. Little red bites. Number 32 is false. 33, the term furnicle is used to describe a skin tag. False. That's a boil. 33 is false. 34, aneurysm is caused by the presence of excessive acid. False. It's a blood clot. Question 34 is false. 35, hypertension is more common in Canadians of Asian, African, Aboriginal descent. True. 35 is true. 36, hypertension increases if excess weight is stored in the abdomen. True. 36 is true. 37, good skin care and regular position changes can help prevent breakdown. True. 37 is true. 38, with persistent renal failure, nephrons of the kidneys are destroyed. True. 38 is true. 39, clients with persistent renal failure have dialysis to remove waste. True. 39 is true. Question 40, the most important way to prevent the spread of hepatitis is practicing standard practices. True. 40 is true. 41, age reduces the client's ability to fight infections. True. 41 is true. And 42, use of condoms helps prevent the spread of STIs. True. 42 is true. Good. Now let's look at question 43 to 62. Multiple answers for these. 43. Which of the following are early warning signs of cancer? B as in boy, D as in dinosaur, E as in elephant, G as in good, H as in house, I as in I am, J as in jumping. 43. Answers are B, D, E, G, H, I, J. Good. Question 44. What side effects of radiation therapy cause cancer to have special care needs? A as in apple, B as in boy, D as in dinosaur, E as in elephant, F as in food. Question 44. Answers are A, B, D, E, F. Good. Question 45. A child falls, has signs and symptoms of a fracture. These would include A as in apple, B as in boy, C as in cat, E as in elephant, F as in food. Question 45. Answers are A, B, C, E, F. Good. Question 46. What treatments are used to relieve pain and stiffness in a client who has arthritis, osteoarthritis? A as in apple, B as in boy, D as in dinosaur, E as in elephant. Question 46. Answers are A, B, D, E. Good. 47. Which of the following are rules you should follow when caring for a client with a cast? B as in boy, E as in elephant, F as in food, G as in good, H as in house, I as in I am, J as in jumping. Question 47. Answers are B, E, F, G, H, I, J. Good. Flip over the page. Question 48. When you care for a client who has a hip fracture, what measures are important? A as in apple, B as in boy, E as in elephant, F as in food, H as in house, I as in I am, J as in jumping. Question 48. Answers are A, B, E, F, H, I, J. Good. Question 49. If you're caring for a client who had a stroke, you might observe effects such as A as in apple, C as in cat, D as in dinosaur, E as in elephant, F as in food, H as in house, J as in jumping. Question 49. Answers are A, C, D, E, F, H, J. Good. Question 50. What measure would be helpful to use when you care for a client who had a stroke? C as in cat, D as in dinosaur, E as in elephant, F as in food, G as in good. Question 50. Answers are C, D, E, F, G. Good. Question 51. Infants and children may suffer brain damage from acquired brain injuries caused by A as in apple, B as in boy, C as in cat, D as in dinosaur. Question 51. Answers are A, B, C, D. Good. Question 52. How can you help the client with pneumonia to breathe more easily and be more comfortable? B as in boy, C as in cat. Question 52. Answers are B, C. Good. Question 53. What damage can hypertension do to a body organ? A as in apple, B as in boy, C as in cat, D as in dinosaur. Question 53. Answers are A, B, C, D. Good. Questions 54. Next page. Which risk factors of coronary artery disease can be changed through lifestyle? A as in apple, B as in boy, C as in cat, D as in dinosaur, E as in elephant. Question 54. Answers are A, B, C, D, E. Good. Question 55. What signs and symptoms would tell you a client is experiencing angina pectoris? B as in boy, C as in cat, E as in elephant, F as in food, G as in good. Question 55. Answers are B, C, E, F, G. Good. Question 56. If a client is having a heart attack, signs and symptoms are B as in boy, C as in cat, D as in dinosaur, F as in food, G as in good, H as in house, I as in I am, J as in jumping, K as in kettle, L as in lady, M as in mother, N as in November. Question 56. Answers are B, C, D, F, G, H, I, J, K, L, M, N. Good. Question 57. How is pain from angina relieved or avoided? B as in boy, C as in cat, D as in dinosaur, E as in elephant, F as in food. Question 57. Answers are B, C, D, E, F. Good. Question 58. When you're caring for a client with acute renal failure, the care plan is likely to include which of the following instructions? B as in boy, E as in elephant, F as in food, G as in good. Question 58. Answers are B, E, F, G. Good. Question 59. What are the signs and symptoms of hepatitis? A as in apple, C as in cat, E as in elephant, G as in good, H as in house, I as in I am, J as in jumping. Question 59. Answers are A, C, E, G, H, I, J. Good. Question 60. Complications of diabetes mellitus include A as in apple, B as in boy, C as in cat, D as in dinosaur, E as in elephant, F as in food. Question 60. Answers are A, B, C, D, E, F. Good. Flip over the page. Question 61. AIDS is spread by B as in boy, C as in cat, D as in dinosaur, E as in elephant. Question 61. Answers are B, C, D, E. Good. Question 62. What signs and symptoms may occur with both hypoglycemia and hyperglycemia? A as in apple, B as in boy, C as in cat, D as in dinosaur, E as in elephant, F as in food, H as in house. Question 62. Answers are A, B, C, D, E, F, H. Good. Question 63 to 78 now. One answer for these. Question 63. What is a helpful suggestion you can give a client who has pain with arthritis? C as in cat. Follow healthcare provider's recommendations. Question 63. The answer is C. Question 64. Which of the following is a cause of osteoporosis? B as in boy. Lack of dietary calcium. Question 64. The answer is B. Question 65. When caring for a client with a recent hip replacement, what activity can cause the hip to dislocate? C as in cat. Any activity that bends the hip joint by more than 90 degrees. Question 65. The answer is C. Question 66. Gangrene can occur because B as in boy, infection injuries decrease circulation. Question 66. The answer is B. Question 67. Transient ischemic attack is B as in boy, occurs when blood supply to the brain is disrupted for a short period. Question 67. The answer is B. Question 68. When caring for a client with a spinal cord injury, you would, B as in boy, follow bowel and bladder training programs. Question 68. The answer is B. Question 69. You're caring for a client with angina. You find a bottle of nitroglycerin at the bedside. What should you do? D as in dinosaur, and make sure they remain where the client put them. Question 69, the answer is D. Next page, question 70, which of these measures would include the treatment of a client with a congestive heart failure? A as in apple, measuring client's weight daily. Question 70, the answer is A. Question 71, childhood communicable diseases are most commonly transmitted by A as in apple, airborne spread. Question 71, the answer is A. Question 72, which disease do signs and symptoms describe? C as in cat, cancer. Question 72, the answer is C. Question 73, which disease do signs and symptoms describe? C as in cat, multiple sclerosis. Question 73, the answer is C. Question 74, which disease do signs and symptoms describe? A as in apple, stroke. Question 74, the answer is A. Question 75, which disease do signs and symptoms describe? D as in dinosaur, emphysema. Question 75, the answer is D. Question 76, which disease do following signs and symptoms describe? B as in boy, Parkinson's. Question 76, the answer is B. Question 77, what area of the body would be paralyzed if your client had a cerebral spinal injury? A as in apple, neck down. Question 77, the answer is A. Question 78, spinal cord injuries in thoracic level may cause C as in cat, paraplegia. Question 78, the answer is C. Flip over the page. Question 79, acquired brain injury is defined as D as in dinosaur, any type of sudden injury that causes brain damage. Question 79, the answer is D. Good. Questions 80 to 91. Read the phrase, put the correct answer. Question 80, person develops barrel chest. That's B as in boy, emphysema. B is the answer for question 80. Question 81, mucus inflamed breathing passages. A as in apple, chronic bronchitis. A is the answer for question 81. Question 82, walls of alveoli are less elastic. B as in boy, emphysema. 82, the answer is B. Question 83, trembling. A as in apple, hypoglycemia. Question 83, the answer is A. Question 84, nausea, vomiting. B as in boy, hyperglycemia. Question 84, the answer is B. Question 85, cold, clammy skin. A as in apple, hypoglycemia. Question 85, the answer is A. Question 86, flushed face. B as in boy, hyperglycemia. Question 86, the answer is B. Question 87, tiredness and fatigue. B as in boy, hyperglycemia. Question 87, the answer is B. Question 88, dizziness. A as in apple, hypoglycemia. Question 88, the answer is A. Question 89, dry skin. B as in boy, hyperglycemia. Question 89, the answer is B. Question 90, sweating. A as in apple, hypoglycemia. Question 90, the answer is A. Question 91, slow labor breathing. B as in boy, hyperglycemia. Question 91, the answer is B. Good. Next page, match the left column with the right column. Question 92, type 1 diabetes is B as in boy. Occurs most often in children. Question 92, the answer is B. Question 93, type 2 diabetes, C as in cat, develops in adulthood. Question 93, the answer is C. Question 94, gestational diabetes, A as in apple, develops during pregnancy. Question 94, the answer is A. Good. Fill in the blanks now for question 95. Why does a client with osteoarthritis have more pain when standing and walking? Answer is pain occurs with weight bearing and joint motion. Pain occurs with weight bearing and joint motion is the answer for question 95. Question 96, what type of arthritis occurs in children? Juvenile rheumatoid arthritis. Juvenile rheumatoid arthritis is the answer for question 96. Question 97, what are the goals in treating rheumatoid arthritis? So the answer for A is maintain joint motion. Maintain joint motion is the answer for A. The answer for B is control pain. Control pain is the answer for B. And the answer for C is prevent deformities. Prevent deformities is the answer for C. Good. Question 98 for the following signs and symptoms. Explain the possible causes. So the answer for 98A is a pressure ulcer could have developed. A pressure ulcer could have developed is the answer for 98A. The answer for B is reduced blood flow to the area. Reduced blood flow to the area is the answer for B. The answer for C is reduced blood flow to the area. Reduced blood flow to the area is the answer for C. The answer for D is reduced blood flow to the area. Reduced blood flow to the area is the answer for D. The answer for E is infection. Infection is the answer for E. The answer for F is pressure on nerve. Pressure on nerve is the answer for F. The answer for G is pressure on nerve. Pressure on nerve is the answer for G. The answer for H is cool skin means poor circulation. Hot skin means inflammation. Cool skin means poor circulation. Hot skin means inflammation is the answer for H. The answer for I is infection. Infection is the answer for I. And the answer for J is infection. Infection is the answer for J. Good. Flip over the page. Question 99. When extremity must be amputated because of gangrene, what areas of life may be affected? So the answer for 99A is body image. Body image is the answer for A. The answer for B is daily activities. Daily activities is the answer for B. And the answer for C is work. Work is the answer for C. Good. 100. Why are older clients at higher risk for serious problems with hip fractures? So the answer for A is healing is slower. Healing is slower is the answer for A. And the answer for B is at risk for life-threatening post-operative complications. At risk for life-threatening post-operative complications is the answer for 100B. Good. 101. A client with Parkinson's disease may need assistance with. So the answer for A is activities of daily living. Activities of daily living is the answer for A. The answer for B is promoting normal elimination. Promoting normal elimination is the answer for B. The answer for C is speech. Speech is the answer for C. And the answer for D is movement. Movement is the answer for D. Good. 102. A client with COPD must stop smoking. Smoking is the answer for 102. 103. How can you help a client with pneumonia breathe more easily? So the answer for A is provide adequate fluid. Provide adequate fluid is the answer for A. The answer for B is Fowler's position. Fowler's position is the answer for B. And the answer for C is assist with oxygen therapy. Assist with oxygen therapy is the answer for C. Good. 104. How are tuberculosis bacteria spread? Airborne droplets. Airborne droplets is the answer for 104. Good. 105. What precautions to prevent infection should be used when caring for a client with tuberculosis? So the answer for A is standard practices. Standard practices is the answer for A. And the answer for B is airborne precautions. Airborne precautions is the answer for B. Good. 106. When caring for a client with TB, how should you dispose of the tissue? So the answer for A is flush down the toilet. Flush down the toilet is the answer for B. Is the answer for A. And the answer for 106B is place in biohazardous bags and dispose following policy. Place in biohazardous bags and dispose following policy is the answer for 106B. Good. 107. How do these risk factors affect hypertension? So the answer for A is increases at 35 years of age. Increases at 35 years of age is the answer for A. The answer for B is common among Asian, Aboriginal, and African descent. Common among Asian, Aboriginal, and African descent is the answer for B. The answer for C is a greater chance if parent has abdominal obesity. A greater chance if parent has abdominal obesity is the answer for C. The answer for D is increases, especially around the waist. increases, especially around waist, is the answer for D. The answer for E is may raise blood pressure. May raise blood pressure is the answer for E. The answer for F is contributes to hypertension. Contributes to hypertension is the answer for F. And the answer for G is increases blood pressure. Increases blood pressure is the answer for G. Good. Next page, question 108. What measures could you use when caring for a client with heart failure? So the answer for A is meet basic needs. Meet basic needs is the answer for A. The answer for B is measure intake and output. Measure intake and output is the answer for B. The answer for C is daily weight. Daily weight is the answer for C. The answer for D is restrict fluids. Restrict fluids is the answer for D. And the answer for E is assist with ambulation and self-care activities. Assist with ambulation and self-care activities is the answer for E. Good. 109. Why are older clients with heart failure at risk for skin breakdown? They have fragile skin. They have fragile skin is the answer for 109. Question 110. If you're caring for a client who has renal calculi, you should encourage the client to drink 2,000 to 3,000 milliliters. 2,000 to 3,000 milliliters is the answer for 110. 111. With acute renal failure, recovery may take 1 month to 1 year, and some do not recover. 1 month to 1 year, and some do not recover is the answer for 111. 112. With chronic renal failure, the nephrons of the kidneys are slowly destroyed. Slowly destroyed is the answer for 112. 113. Dialysis is done with chronic renal failure to remove waste and excessive water in blood. Waste and excessive water in blood is the answer for 113. 114. What measures are used to care for a client with chronic renal failure? So the answer for A is limit fluids. Limit fluids is the answer for A. The answer for B is measure blood pressure. Measure blood pressure is the answer for B. The answer for C is measure weight. Measure weight is the answer for C. The answer for D is oils, lotions, creams for skin. Oils, lotions, creams for skin is the answer for D. The answer for E is oral hygiene. Oral hygiene is the answer for E. The answer for F is encourage rest. Encourage rest is the answer for F. And the answer for G is meet basic needs. Meet basic needs is the answer for G. Good. Question 115. Why is good foot care important for a person with diabetes? They have poor healing and poor circulation. High risk for gangrene or amputation. They have poor healing and poor circulation, and are high risk for gangrene or amputation are the answers for 115. Good. 116. To protect yourself from contracting hepatitis, you use gloves for pericare. Gloves for pericare is the answer for 116. Question 117. Signs and symptoms of age related to the following include. So the answer for A is purplish blotches. Purplish blotches is the answer for A. The answer for B is white spots on tongue and mouth. White spots on tongue and mouth is the answer for B. The answer for C is memory loss, diarrhea for more than a week. Memory loss, diarrhea for more than a week is the answer for C. And the answer for D is rapid weight loss, diarrhea for more than a week. Rapid weight loss and diarrhea for more than a week is the answer for D. Good. 118. Why does a client with AIDS often develop other diseases? AIDS reduces ability to fight infections. AIDS reduces ability to fight infections is the answer for question 118. Good. Flip over the page and question 119. Sexually transmitted infections may enter the body through many areas such as genital area, rectum, ears, mouth, eyes, and nose. Genital area, rectum, ears, mouth, eyes, and nose are the answers for question 119. Good. Question 120. Color the area that would be paralyzed if the person had a cerebral spinal injury. Color everything below the neck. Everything below the neck is the answer for question 120. And question 121. Color the area that would be paralyzed if your client had a lumbar spinal injury. Everything below the waist. Everything below the waist is the answer for question 121. And that's it for chapter 33.